Hello, my name is Erin Lewis, and I will be addressing the link between ADHD, stimulant use, and surrounding stigmas. So, some key terms that I will be using in my presentation are attention deficit and hyperactivity disorder, also known as ADHD, morbidity, stimulants, substance use disorder, which I will be referring to as SUDs, amphetamine, methamphetamine, and marginalized. So what is ADHD? Well, ADHD is a neurodevelopmental disorder commonly diagnosed early on in childhood. Some symptoms include inattentiveness, hyperactivity, impulsivity, risky behaviors, and so much more. So, comorbidity is the presence of two or more diseases or medical conditions in an individual. It is extremely important to address this topic to improve diagnoses and treatment for those with ADHD, to reduce the stigma surrounding stimulant use, as well as to encourage those in marginalized communities to seek treatment if necessary. So stimulants, specifically amphetamines like Adderall and methamphetamines like Vyvanse, are the most commonly prescribed forms of medication to treat ADHD because they stimulate the nervous system, increasing dopamine, norepinephrine, which improve attention, memory, and motivation, which is why they are the most effective forms of treatment. So the controversy regarding amphetamines sparked in the late 90s, but has been under strict control since the passage of the Federal Drug Abuse Control Substance Act of 1965. And one of the most popular beliefs about amphetamines is that they are highly addictive, more so than any other drug. And this is mentioned in Dr. Carl Hartz's book, High Price. So studies have shown that ADHD comorbidity does increase the risk factor for developing a substance use disorder, either directly or mediated by conduct disorder. It has also been found that people with ADHD tend to become addicted at younger ages. They use more substances, hospitalize more than SUD patients without ADHD, and have higher relapse rates after successful addiction treatment. But in contrast, other studies have found that the use of central stimulant medication in substance dependence populations does not lead to an increase in craving or drug use, but rather treatments like methylphenidate may lead to a reduction in drug use as well as in ADHD symptoms. And similarly, other research has proven that while having ADHD does increase the risk of developing a SUD, it is not necessarily true that prescribing a stimulant will increase the risk, but instead, not medicating someone with ADHD can increase the risk of seeking treatment through the use of illicit substances. And as mentioned by Dr. Hart, methamphetamine abusers tend to have severe cognitive impairments, which only demonstrates that comorbid disorders only increase the risk of substance use disorders in those with ADHD. And because ADHD is typically a comorbid diagnosis, studies have shown that 53% of adults report misusing their stimulant medication and at least one prescribed psychiatric drug in their lifetime, which it supports the dual diagnosis hypothesis that a person can have a mental health disorder and a substance use disorder at the same time. And this only emphasizes the importance of making careful assessments when prescribing psychostimulants. So, a current diagnosis of ADHD implies a onset of ADHD with persisting symptoms in adulthood that currently meet DSM criteria. However, there was a time when studies excluded the age of onset criterion for ADHD, and some of the criterion include studies that have associated ADHD with juvenile offenders exhibiting delinquent behavior, using imputation techniques to estimate the ADHD prevalence, as well as involving patients in treatment for psychiatric disorders who have comorbid SUDs. But ADHD is extremely common in populations with SUDs and comorbidity. So to receive an amphetamine dependence diagnosis, a person must fulfill the DSM criteria for amphetamine dependence during the last 12-month period. However, this version excluded past criteria, a few of them being current or past DSM diagnoses of any substance dependence, except for nicotine, history of any major psychiatric disorder or any current psychiatric conditionings requiring medication, and um, any use of opioid medication or illicit opioids in the last month. So throughout the High Price book, Dr. Hart talks about his experience growing up in the 80s during the crack cocaine epidemic and witnessing his friends, family members, and just people in his community fall victim to substance use addictions, and sometimes even become imprisoned. And historically, substance abuse has been an issue within the marginalized communities. And marginalized people can include the impoverished, the poorly educated, the elderly, ethnic and cultural and minority groups, as well as those who are physically and mentally disabled. And Mary Jean Creek states that those with specific addictive diseases and those who are imprisoned for nonviolent and violent crimes are possibly the most marginalized of all. And all persons of color who can fall under any of these categories are disproportionately impacted by the drug epidemic. In his article, Use and Abuse of Amphetamine Types in the United States, Luna there states that there are underlying and unaddressed social inequalities that may have an impact on patterns of substance use and abuse, including amphetamines. He also states that patterns of substance abuse in the U.S. could be explained by the increasing competition to survive financially and interpersonally, and that those who are failing to adapt to rapid technological change have to self-medicate to temporarily avoid social and economical inequalities. And since the early 1900s, amphetamine users and abusers have primarily been blue-collared white men in the Western United States, and today they still are predominantly used by middle-class white teenagers and young adults. Subculture and amphetamine type stimulants, which Luna does refer to as ATSs, have been strongly associated with young people and ethnicity, socioeconomic status, sexual orientation, musical preference, and geographical and environmental determinants, which all influence youth's access to and choice of ATSs. Dr. Hart stresses the point that misinformation demonizes methamphetamine users and discourages them from seeking help. Um, in his methamphetamine study, he found that methamphetamine produced the same effects as Adderall because their chemical structures are nearly identical. He also found that taking methamphetamine by mouth produces the least amount of intense effects. And the participants in his study reported that they feel more euphoric and their cognitive functioning improved, similar to the effects reported by his participants. Um, it was also found that Adderall and Vyvanse increase energy, enhance ability to focus, reduce tiredness, as well as cognitive disruptions caused by fatigue or sleep deprivation. And in a study looking at the positive roles of drug use by Andrew Ivesons and Kevin Yake, they interviewed 50 people who use drugs, and 43 out of the 50 of the participants reported positive drug use. And participant narratives revealed four main themes. Those four themes include pain relief and management, alleviating mental health issues, fostering social experiences, and pleasurable embodied experiences. And the objective of their study was to demonstrate that given the opportunity, meaningful and useful conversations that shed light on why people take drugs is possible. So with the treatment plan, there are challenges, but also solutions. So getting treatment for people with amphetamine addictions can be extremely difficult. For example, people who use methamphetamine become overly excitable and resistant to any form of intervention. And because of this, methamphetamine users are likely to end up in treatment due to encounters with the police for aggressive behaviors and inappropriate conduct. And over 7 million people who are imprisoned in the United States, and over 60% of them of the inmates are African American or Hispanic American, and a very high proportion of those in jail or in prison, they have abused drugs or have substance use disorders to more than one drug. And the problem of poor access to treatment becomes more prominent when we look at jails or prisons where there's an obvious need for it. However, when diagnosed in prison, addiction treatment is not necessarily, it's not a standard of care or a component of rehabilitation within the jails or prisons. And despite the fact that the relapse rate to drug abuse and addiction is enormous after release, and it just leads to a vicious cycle of addiction, crime, and incarceration, especially with the presence of other psychological disorders. In order to develop adequate treatment programs, it's important to distinguish overlapping disorders to provide a proper diagnosis. Researchers have recommended that resources should be directed toward addressing dual diagnosis, issues of multiple physical and mental health problems, and toward improving or providing ancillary support services. Treatment programs should apply such techniques like pharma pharmacotherapy, psychoeducation, um, behavioral intervention, skills training, as well as case management. They should also focus on relapse prevention and on the 12-step approach to social recovery. There are also holistic approaches to recovery, including improving diets, taking vitamins, getting more sleep, or even relocating to a new environment, as well as just any dramatic lifestyle changes. Um, it was also mentioned by Creek, possibly the most important goal to be focused on within the fields related to social neuroscience is the um, eradication of stigma through an increase in our knowledge and sharing and teaching that knowledge to all. So overall, it is crucial to make careful assessments when prescribing stimulants to individuals with comorbid diagnoses. It is equally important to eradicate the stigma on stimulants such as amphetamines and methamphetamines so that people feel comfortable to seek out proper treatment without scrutiny. And here are my citations. And thank you for listening to my presentation.